The Ministry of Health has confirmed 2 cases of human metapneumovirus cases in Karnataka in India. These cases were identified through routine surveillance for respiratory viral pathogens under ICMR's ongoing efforts to monitor respiratory illnesses nationwide. While HMPV is already known to circulate globally, including in India, the ministry emphasized there has been no unusual surge in influenza-like illness or severe acute respiratory illness cases, according to the current data from ICMR and the Integrated Disease Surveillance Program. The 2 confirmed cases involve infants. A 3-month-old female infant diagnosed with HMPV following hospitalization for bronchopneumonia in Bengaluru. She has since been discharged. And an 8-month-old male infant who tested positive for HMPV on January 3, 2025 after being admitted with bronchopneumonia. He is now recovering. However, concerns about HMPV are growing globally. In Malaysia, cases rose sharply in 2024 with 327 reported cases, a 45% increase from 225 cases in 2023. China's CDC has also flagged HMPV as concern, particularly for children, immunocompromised individuals, and elderly, who are more susceptible to severe outcomes. According to a study published in Lancet Global Health, 1% of acute lower respiratory infection related to deaths in children under 5 can be attributed to HMPV. Currently, there is no vaccine or specific antiviral treatment for HMPV. So now let's delve deeper into what HMPV is, its symptoms, how it spreads, and the steps you can take to protect yourself. Starting with what is human metapneumovirus or HMPV. First identified in 2001, HMPV is part of the Pneumoviridae family. It's a respiratory virus that causes both upper and lower respiratory infection. While most people experience flu-like symptoms, vulnerable groups like young children, older adults, and immunocompromised individuals can face more severe complications, including bronchitis and pneumonia. So here are the symptoms you need to watch out for. Common symptoms of HMPV include cough, fever, nasal congestion, shortness of breath. In severe cases, these symptoms can progress to bronchitis or even pneumonia. The incubation period typically lasts 3 to 6 days, and recovery can take several more days, depending on the severity of the infection. How does HMPV spread? HMPV is highly contagious and spreads in multiple ways. These are through droplets from coughing or sneezing, by touching contaminated surface, and then your mouth, nose, or eyes, through close personal contacts like handshakes. The virus can remain active on surfaces at room temperature, making hygiene a crucial part of prevention. In temperate climates, HMPV circulates seasonally, especially from the late winter to spring. Here are the preventive measures. There is currently no vaccine or specific treatment for HMPV, but prevention is key. Here is what you can do. You should wash your hands frequently with soap and water for at least 20 seconds. You should avoid touching your face with unwashed hands. You should clean commonly used surfaces like doorknobs and toys. You should stay home if you feel sick. If you or your children are showing cold-like symptoms, practice good respiratory hygiene. Cover your mouth and nose when coughing or sneezing, and avoid sharing utensils or kissing others. Testing and diagnosis. If you suspect an HMPV infection, consult a healthcare provider. Diagnosis typically involves testing respiratory secretions through advanced techniques like nucleic acid amplification tests or immunofluorescence. How big a threat it is? According to CDC, HMPV can be deadly for those with underlying health conditions. For children under 5, the virus accounts for 1% of acute lower respiratory infection-related deaths globally. Without a vaccine, treatment is currently limited to managing symptoms, making awareness and prevention more critical. As cases continue to rise globally, staying informed and practicing preventive measures can help curb the spread of HMPV. So stay safe, stay informed, and stay healthy.